Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Today we'll be looking at the arterial and the venous thrombi. So the first is, let's look at the arterial thrombi. This is the pathogenesis being the endothelial injury or the site of turbulence. So it's endothelial injury or the site of turbulence. Now when you look at venous thrombus, it is the stasis of the blood. So this is basically stasis of the blood. Now, how is the blood flow in case of the arterial thrombus? It is associated with the active blood flow. So there is presence of active blood flow. This is in case of arterial. In case of venous, there is associated with the sluggish blood flow, and there is stasis as well. Now, what about the site? The site is in arterial thrombus is coronary, cerebral, and the femoral arteries. So there is coronal, cerebral, and the femoral arteries. In case of arterial thrombus, the sites includes the coronary, cerebral, and the femoral arteries. Now, let's look at the venous thrombus. In terms of venous thrombus, it is the superficial deep leg veins and also the ovarian periuterine veins. The arterial thrombus, it grows in the retrograde manner from point of attachment. So retrograde, this is in terms of the arterial. And in case of venous, it grows from the anterograde manner from point of attachment. Now, how is the line of Zane? The line of Zane is present in case of the arterial, whereas in venous thrombi also it is present. Now, talking about the microscopy. In arterial, it's a fibril meshwork of platelets. So, fibril or meshwork of platelets, fibrin red cells, and also the degenerating. So, it's degenerating leukocytes. Degenerating leukocytes are known as the white thrombi. Now, in case of venous, it is the red cells which are mixed with the relatively less platelets. Red cells with mixed with relatively less platelets, and also they are known as the red thrombi. So this is with the venous thrombi. Now, in case of arterial, it was white. Here, in case of venous, it is going to be red thrombi. So occlusion is, there is an incomplete lumen occlusion, whereas in venous there will be a complete occlusion. Now, what are the complications? The complication is, in case of arterial, this leads to the ischemia and also the infarction. Now, when you look at the venous thrombi, it is embolism, edema, and the ulceration. So there can be embolism, there can be edema, as well as the ulceration can be seen. To learn and grow daily like this, please do subscribe.